At 27 minutes past 11 on GZU Campus Radio. My name is Tavita Natasha Mbala, and welcome to this special program proudly sponsored by TellZim News and the Zimbabwe Coalition on Debt and Development. And today I am joined in the studio by Rogers Irimai, who is the Provincial Task Force spokesperson for Mashingo, and Teresa Takafuma, who is the Innovations and IT Officer from TellZim. Teresa and Mr. Irimai, how are you? And welcome to GZU Campus Radio.
Hello, Tavita.
Hello, how are you?
I'm good. So happy to have you guys in the studio, and we get to discuss issues to do with COVID-19. If you've got any questions, please do send us a message on 0785 My first question is going out to you, Mr. Irimai. I will need you to give us an update on COVID-19 in Mashingo and the state of affairs pertaining to COVID-19 as we speak right now.
Thank you very much. Let me start by highlighting to you listeners out there that coronavirus is still among us. That's the first and foremost thing that you should understand, that it has not yet gone. We still have it. Let me give you the figures that we have. The statistics at the moment in the province stand as follows. Just yesterday, on the 7th of April 2021, 124 tests were carried out. And out of those 124, 6 came out positive. We are saying in our districts, in the 7 districts of Masvingo, we have testing centers. And from our testing centers, that's where we are getting these results. The 6 came out from Chiredzi. The other districts recorded zeros, meaning Chiredzi had a high figure yesterday of those positive cases. Now, as we are talking, we have now 13 active cases in the province. 13 is a very, very high number, because remember, when we first had the COVID-19, we had our first case there in Victoria Falls. The country panicked. 1 case only. Now we are talking of 13 cases, and our death figure still stands at 67. Yes, we had recently one death which was tested. A person had already died. This one was tested at Silvera Mission Hospital there in Bikita, and the body tested positive. But we had 66 for quite a long time. So with that one, it rose. Our recording death recordings went up to by 1 to 67. So at the moment, we now have a cumulative positive figure since the onset of this pandemic. We now have a cumulative figure at 2,395. And the number of cases that have recovered in our province now stand at 2,315. Those are the statistics that we have as a province. But nationally, we have a death rate, number of people who died from this pandemic is now at 1,531, which is really high. Then yesterday, from the tests that were done, Masvingo, we said we had 6, and we had the highest number. We got a total of 18 positive cases yesterday alone. This is the situation that we are now having in the country. So 18 out of 3,301 tests that were done nationally, we had 18 cases. And Masvingo was at the top, seconded by Harare, which had 4. Now, just looking at it, we are still having the problem with us.
Teresa, Mr. Irimai spoke that in Masvingo yesterday we recorded 6 cases that were positive to COVID-19. And as a province, we have 2,395 cases recorded throughout the duration of the COVID-19 pandemic era. And then we have 2,315 recovered cases. Do you think that the media is doing enough to provide information on COVID-19 and how best people can stop the spread of the virus?
Thank you for the question, Tavita. I think as the media, we are trying our best to report issues to do with COVID and to let people know that the pandemic is still with us. And because since the country lifted some of the COVID-19 restrictions, people have a tendency to relax, thereby exposing themselves and, heightening the risk of contracting COVID. So I think the media is doing whatever they can to make sure that people have the information that they should have, and also to encourage people to get vaccinated, because there's a lot of misinformation about the virus itself and vaccination. So I think the media is trying its best to report these issues in a way that lets people know that the pandemic is still with us in terms of infographics, social media, and using whatever platform that we can to report about COVID-19 and the vaccination program. So I think, the media is doing the best they can to highlight these issues.
Send us a message on 0785 This program is proudly brought to you by TellZim News and ZIMCODD, which stands for Zimbabwe Coalition on Death and Development. And Teresa just spoke about the misinformation on vaccinations. And that brings me to my next question to you, Mr. Irumai. How was vaccination distributed in Masvingo, and how many jabs are available in Masvingo so far? And how has the response been like, especially from the private and also the public sector?
Thank you. Let me start by saying that we received in the first, from the first lot that came to our country. We remember we received quite a number of vaccines from China. Then from the first lot, Masvingo got 22,000 vaccines. Then when these injections came to our province, we first attended to frontline workers. These were not education, but these were from the Ministry of Health, staff from the Ministry of Health. We had a focus on journalists. We also focused on the police. We focused on the immigration department. So from Masvingo, the first phase included those that I've just highlighted. When they were injected, we had an outreach of 10 days first. Then about 3,600 were injected in the first 10 days. However, the program did not stop. It continued, but it was now in district centers. Then came the second jab. Those who received the first jabs again received their second jabs from the 22,000. Then we also had the phase 2 introduced. That is when we saw the president launching the second phase in Blawa, in Victoria Falls, I mean. Victoria, when the president visited Victoria Falls, and he launched there. Now, in this second phase now, we were looking at the tobacco industry staff. One, we looked at teachers and lecturers in secondary schools, primary schools, and universities and colleges. Then this is now going on. We are already in the second phase. These are now being injected. So among them, we also have the chronically ill who are also getting their the jabs. Then we also have another category of the old aged. So we now have a number of people that have. At first, people were hesitant. They were suspicious. They were afraid of getting the jab. Now, when our leaders, we are talking of the president, the vice president, and the ministers, received their jabs, people became, some people now So it was quite so if the president, if our leaders can receive this jab, why can't we? And then they are not dying. Eh? Because social media, I'm happy because when Teresa was highlighting this, she said, so media is working flat out to ensure that messages. Yes, that is when we are talking of the conventional media. But we have got another category of media, which is the social media. There are quite a number of myths, misinformation that is being disseminated by through social media, where others there are quite a number of theories that are being spread. Some are saying that the whites, they want to destroy the black race. That's another theory. Another theory, they are saying this is a warfare, a biological warfare. Another theory is a religious one, where others are saying this is now, we are now reaching the end of the world. So if you go to Revelation 13, they talk of the mark of the beast. So this is the mark of the beast, the vaccination. So yes, 666. So you see, those myths are spreading, and we have a category of number of people who are now hesitant to receive the vaccination. Now, it is now the job of the media, not only the media, I think everyone else should now be involved in trying to demystify these myths. Because some people are really afraid of getting the jab. I know a number of people, I've talked to others, but I'm glad to inform you listeners out there that we now have a change of heart among many people after noticing that those who received their first jabs, there were no side effects at all. No one died, no one lost his maybe eyesight or whatever, because some others were anticipating that there might be those effects. So people are now receiving their jabs. We have now seen a significant number of people turning up at these vaccination centers. So yeah, there is quite a rise in the turn up.
So of the 22,000 jabs that Masvingo province got, how many are left so far in the stock?
At the moment, when I talked to the provincial medical director this morning, it shows that we exhausted the 22,000. I'm sure we are, because we received another consignment of the Sinovac. So we are now using the Sinovac. But already districts have exhausted what they received.
Wow.
Some districts are now waiting for the other supply. And the provincial medical director was saying this week they are expecting another lot to arrive.
Send us a message on 0785-133-068, a program sponsored by ZIMCODD and TellZim News. We'll focus more on these myths, and we get to talk more to Teresa and find out what the media is doing to dispel these myths that Mr. Irimai spoke of. A song coming through from Jah Praise and ZIMCODD on GZU Campus Radio. You are listening to Great Zimbabwe University Campus Radio. My name is Tavita Natasha Mpala, and this is a special program proudly sponsored by TellZim News and ZIMCODD. And in the studio, I am joined by Mr. Rogers Irimai and also Teresa Takafuma. And before we listen to the song coming through from Jah Praise, it's called Ngoda, we're focusing on COVID-19 and the conspiracy theories and myths around the vaccination. And now my next question is going out to you, Teresa. Mr. Irimai spoke lengthily at the various myths that are associated by the vaccination in Zimbabwe per se. What do you think is the role of the alternative media in making sure that, in as much as people be bound to create their own theories, that correct information is out there? And I'm saying this in the light that mainstream media houses have got bubbling and highly vibrant social media platforms. What can then media houses do to dispel all these myths that are there on social media?
I think, in my opinion, I think the first thing to do is just to realize that responsibility on our part is vital. It's vitally necessary, and we people rely on us for correct, verified information. So I think as the media, we are bound to report correct information and not to have a pedestrian approach to these things, because the messages that we put out there, they really affect people. There are people who rely on us for decision making. So it's up to us now to send out correct, clear messages on our social media platforms. As you mentioned, that we have vibrant social media platforms. Every other media house is vibrant social media platforms. We should then use them to responsibly report about the vaccine and the COVID-19 pandemic in a way that even when they see it on social media, where there is a lot of false information and misinformation flying around, then people have an alternative source of information that is verified, because we have to then there's a tendency of people gaining trust with us, with the messaging that we put out there. So it's up to us now to be responsible, to put out correct, verified information that is well researched, and to actually approach opinion leaders, health experts, who know we have the information about COVID-19 and about the vaccine. And I've seen also that a lot of journalists went out and got vaccinated. That was a very responsible of them to actually have a first-hand experience of the of the process, so that when they go out and report, they have the correct information and they know what it is all about before they start writing about it. So I think even on our personal social medias, we posted pictures of ourselves having vaccinated. That was very responsible, because there are people who rely on us. So I think as the media, that is now up to us. We should go there where the misinformation is, that is on social media. Because, yeah, of course, the mainstream media is the alternative voice. Social media probably could be the alternative voice. But then we have to go there where the misinformation is and try to dispel it and put out and counter it with correct information, researched, having spoken to health experts, having spoken to people like Mr. Irimai. We have the correct information about the vaccine, about the COVID-19 pandemic.
Speaking on journalists going to get vaccinated, Teresa, I noticed, like what you highlighted, that a lot of them used visual imagery to post on their social media to say, listen, this is the process that I went through and I've been vaccinated. Do you think that those pictures did help in terms of campaigning for people to go and get vaccinated?
I think they did. In a way, they did. I wouldn't, quantify, but I think they did, because these are human. People want to interact with the human side of whatever media brand.
Yeah.
So I think in a way, it helped, because people now could see that their relative, that now this is whoever, my relative, he is going to be vaccinated. A frontline worker is going to be vaccinated, and he's going on with his life. And also, in a way, it gave some light to accountability, because as the media, we have a role and mandate to demand for accountability from the task force, from the Mr. Irimais here, so that we get information about what then, after getting the first jab, what then goes on? Who are the people who are being vaccinated now? So I think the imagery helped to dispel the myths, to demystify the vaccination process.
Mr. Irimai, you highlighted that Masvingo has yesterday recorded 6 cases that are positive to COVID-19. Is there a possibility of a third wave of COVID-19? And are we ready as a province for the third wave? And what can be done to protect citizens from contracting and also spreading COVID-19?
this is the fear that we now have. There is talk of the third wave striking in other countries, even in neighboring countries like South Africa. They are saying, yes, some people are already affected. And we remember we have lots of our relatives there in South Africa. The challenge that we are having is that when our relatives are coming back home, a few use the regular routes. That is, they come back through the border and they undergo through the mandatory processes of testing COVID-19. Because our government has got a procedure. For you to move into the country, you're supposed to be tested. That is a mandatory procedure, which everyone else is expected to undergo. But now we have got a number of people who cross the border illegally into the country. For example, we are talking of Chirezi. Chirezi shares borders with the South Africa and Mozambique. People might be coming into Chirezi, filtering into the society without going through these processes.
Yeah.
Now, if these people are affected, it means that they are putting everyone else in the communities they are visiting at risk. That might be one reason why we are seeing cases recurring in Chirezi. We see the numbers are going up and down. And if you just look at the trend, in Chirezi, we are having higher figures than in other districts. So we are saying this third wave, if it comes through those who are coming in illegally, we are in for it. We are in trouble because the whole country will be affected. So we are trying by all means to ensure that people are inculcated into understanding that if they receive visitors who have not gone through the mandatory process, they are at risk. They are putting themselves at risk. So people are supposed to report if they see a border jumper arriving. They are supposed to report to officials so that that person is taken to quarantine centers for the mandatory procedures. Now, we are also sending out messages out there to people so that they understand why they are supposed to be vaccinated. Because the moment you are vaccinated, even if the third wave strikes, it won't have an effect, a lethal effect that it is having on those who are not vaccinated. So we encourage people to get vaccinated. That's one major thing. The other thing is that we are also trying by all means to ensure, to encourage people to maintain or to adhere to the regulations that have been put in place by government, the regulations that were recommended by the World Health Organization, that people are supposed to put on their masks, that and they mustn't hang their masks on their chins. They are supposed to cover their nose and mouths. Then they must maintain social distancing so that the transmission is quite limited. We are also encouraging people to stay indoors, to limit on movements. Because the moment you are out there, already you are at risk. Before anything else, the moment you will start mixing with other people, you are putting yourself at risk. So, but by limiting, you only go out whenever it is necessary.
Yeah.
You want to maybe to visit the hospital or to a surgery, or you want to buy something at the shops. But just a mere moving around in the towns or at growth points will be risking yourself. So that's what we are trying to, by all means, and ensuring that people wash their hands regularly with running water and soap. Yes, or using their sanitizers. So I think by doing that, we are trying by all means to limit the transmission of the virus.
0785133068. Let us know your questions. This program is proudly brought to you by TellZim News and ZIMCODD, the Zimbabwe Coalition on Debt and Development. Teresa, as someone who's young and as a woman who is in a leadership position, how has COVID-19 affected women and the youth when we're looking at the social, economic, and also their livelihood front? And how best do you think that entrepreneurs can move from the hand-to-mouth system into creating businesses that are sustainable, just in case the third wave comes and we go back to the lockdown period?
I think as a young woman, I think COVID-19 has brought new facets with it in the way of living. Personally, I would say moving to the virtual way of doing things really helped me, because we are in the business of news. So basically, moving to the virtual way of doing things really helped, because I think it works for a lot of people, even those doing, distributing goods or services, because setting up virtual platforms where you can communicate with your customers and your clients, and then coming up with a way where you can deliver without really moving around a lot. It really helps. So I think as a young woman, I would encourage other young women and the youth to get to know about the virtual platforms that they can use to distribute their goods or services, which is because it is a safer way, because you don't have to interact with a lot of people. So I think that would really work for me, for other people as well as for me. And I also think that as women, we have to look for information. Information is power. I'm always saying information is power, and access to information is empowerment. There's a tendency of just getting, with the flow, but it doesn't help with the improving the livelihood of a woman or of a youth. A lot of information we do have. Sometimes we have the privilege of getting online, but what kind of information are we looking for? Is it improving our lives, or is it improving our opportunities and interacting with the right people, the people that can actually improve your life? So I think we have to relook at the people that we interact with on social media. We have the access to go on WhatsApp, joining the relevant, we create, as TellZim, we created a lot of WhatsApp groups during the lockdowns, so that we could put out information out there, and it doesn't take a lot of data for one to access information. We tried to make it easy for the women and for the youth. So being in one of those groups would really help listeners out there to get the correct information that is verified, and to also look into the opportunities that is there for the women and for the youth, and to also demand for accountability from opinion leaders and from the local authorities in terms of service delivery. So I would say, how are we using our virtual platforms? That we have to relook at into that and see how best we can leverage the situation.
Those are some amazing words. And my last question to you, Teresa, is, like, we are having this radio program proudly sponsored by TellZim and ZIMCODD. What then can be done by other media houses in the private or in the public sector to back up initiatives by government, like, for example, to back up projects that are being done by the task force, and to make sure that people know about COVID-19 and the processes that have to be taken for one to be vaccinated?
I think as TellZim and ZIMCODD, what we have done is use what is available to us in terms of where we can put out our information. Like I mentioned earlier, we do infographics that we put on our social media. We do also skits where we use influencers, like the local influencers that we have, like Varazipi and the Varazipi crew, to do skits that really would attract people to watch them on our YouTube, on Facebook, and on WhatsApp. And that attracts people, because this is somebody they know, and they know as an entertainer, and now they are giving out very important information. So packaging it in that way, it helps them to simplify things. So I would say, as ZIMCODD and TellZim, we've managed to really get into information dissemination using other methods, not the conventional methods, but other methods like I said, skills, infographics, just social media post imagery, using our Twitter handles to put out information that is relevant for vaccination, that is relevant for spreading information about COVID-19, because people want to keep on being reminded that COVID is still there. And also to remind people about the WHO guidelines, the World Health Organization guidelines, like social distancing, properly wearing their mask, because a lot of people just do these things maybe before they were being what can I say, before they were being enforced, wearing of masks before it was being enforced. People were just doing it for, people just think they are doing it for the police. But we really need to keep on reminding people to mask up, to stay safe, to maintain social distance. Is TellZim and ZIMCODD, that's what we've managed to do.
Thank you so much, Teresa, for that one. Mr. Irimai, any last words for our listeners as we still say that people still need to get vaccinated and to also mask up and sanitize at all times?
Yes, thank you very much. We are really concerned, especially when you think of people who are visiting hotspots. Hotspots like boreholes. Women mostly visit boreholes. And remember, when you are at a borehole, you exchange. Kuti mvura yacho ibude munoda kuchinjana kuti mwachipindawo pabata uyu achabatawo achibatawo. You are already at risk. So that's why we are saying now, when you are visiting maboreholes, it is very, very important for you to know kuti inini ndakeza maoko angu akachena. Saka vanamai petiri kuenda kundochera mvura, let us ensure that we try to maintain our hands clean as possible. That was spot. I've been visiting some boreholes and I discovered that we really have a risky situation. So that one yakanyanya. Then kuma buses, we are having a challenge by which is being caused by my illegal transporters. We are having quite a number of mishikashika operating on our roads. The police has been trying by all means to enforce my regulations, limit one is traveling, it's only through ZUPCO buses. But we see one wachingoramba chifamba. The police, let me warn those who are on the roads. The police is out there in full force. They won't hesitate to arrest. So we have got a number of people who have been arrested because of plying on the roads illegally, and the vehicles are being impounded. So let me just warn that the police are not waiting; they are on the roads. Saka mucharama muchingosungwa because munoona kuti panokwira vanhu mumotikari kana muchingango chikombi chiri kungopareta zvisiri pamutemo kana kuti zvimishikashika zvimota zvidiki zvimahonda fiti zvimavhitsi vanotsikirirana, hamuna social distance imomo. So that is exactly what we are talking about now. It is not encouraged at all. We are trying to discourage people kuti wasafambe nezvimotikari izvozvi. Vanhu ngavaende kumabhasi ezubco akaprovidwa negovernment.
Thank you so much, Mr. Irimai. Teresa, do you have any last words for our listeners?
I think for our listeners, I would say let's look for information and let's try to look for verified information. There are a lot of platforms out there that we can make use of. Like I said, we have TellZim, we have ZIMCODD, we have all these other platforms that we can get correct, verified information, because information is power. We need correct, verified information now more than ever, because we are in the era of COVID, and it surprised a lot of people in just after the festive season when COVID names became names of people who we knew. Earlier, before we had been treating it like it's something distant from us, but then the names started becoming people who we know, and they started affecting people who we know. So I think it is very important to look for information and correct, verified information, and not just as individuals stop the spreading of fake news, because it is a very, very dangerous thing to do. And we have to be responsible in our sharing of information, and to the media also. We need also to pull up our socks and do the right thing, and be responsible in our reporting, and know that the information that we put out there is a matter of life and death. People really rely on us. So I would say, let's also look for correct information. And we as TellZim, ZIMCODD, we are trying as much as possible to look for accountability from the task force, so that we get the right information about the vaccination, and to put it out there.
Thank you so much, Teresa. Nasi Platita Zwakawanda, please make sure that you protect your family and you protect yourself. Mask up always. And remember that the change will always begin with you. This program is proudly brought to you by the Zimbabwe Coalition on Debt and Development, and also TellZim News. I was joined in the studio by Rogers Irmai, who is the Provincial Task Force spokesperson for Masvingo, and also Teresa Takafuma, who is the Innovations and IT Officer at TellZim. Keep your messages coming through, and mask up and sanitize always. I'll leave you jamming to the song coming through from Leonard Jakarta, Game Over, and then we'll go into the Afternoon Express on Great Zimbabwe University Campus Radio. Keep it locked on.